Cholera. Cholera is a bacterial disease caused by Vibrio cholerae. It is usually transmitted through contaminated food and water, making it widespread in environments with poor sanitation. Symptoms of cholera include diarrhea, vomiting, and severe dehydration. Keep a clean environment and you may never experience it at all. Tuberculosis. Tuberculosis, popularly known as TB, is an airborne disease caused by Mycobacterium tuberculosis. Suppose you find yourself in a crowded area. You should cover your nostrils well, because TB may be in the air. It is usually transmitted when infected people cough or sneeze. TB shows up with bloody coughs, weight loss, and drips of sweat in the night. Sleeping sickness. Sleeping sickness, or you can call it trypanosomiasis, is caused by the bite of infected tsetse flies found predominantly in Africa. Sleeping sickness comes with symptoms that match its name: unusual patterns and cycles of sleep, added with intense fatigue and sometimes fever. With sleeping sickness, marathon sleep is an unavoidable event. Gonorrhea. Gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. Its spread usually comes as a souvenir from unprotected sexual activities with an infected person. Symptoms of gonorrhea can include painful urination, discharge, and intense itching. Influenza. Influenza is a notorious flu caused by various strains of influenza viruses. It is an airborne infection that spreads quickly in a crowded place where infected people are present. It reminds you to always go around with your nose mask. Symptoms include fever, cough, sore and painful throat, and body aches. Malaria. Malaria is caused by the bite of infected female mosquitoes carrying Plasmodium parasites. These parasites find safe havens in areas filled with stagnant waters as they lay their eggs there and make babies, plenty enough to feast on the blood of their victims. Symptoms of malaria include fever, chills, headache, and body aches. Poliovirus. Poliovirus is highly contagious and is capable of weakening the nervous system. You might not even know you are a carrier at inception, but with time, you begin to feel fever, sore throat, and headache. If it gets worse, paralysis may set in. Syphilis. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. Its early stage can manifest as a painless sore, but it can upscale into a rash, fever, and swollen lymph nodes that, if left untreated, can affect the heart, brain, and other organs. Tetanus. Tetanus is a hazardous infection caused by the bacterium Clostridium tetani, which enters the body through open and untreated wounds. Tetanus can be life-threatening as it starts with mild symptoms like muscle stiffness and spasms, jaw locks, and difficulty swallowing, but it can lead to death if not treated. West Nile virus. West Nile virus is primarily transmitted through infected mosquitoes. It can be very hideous of symptoms, but with time, experiences like fever, headache, and body aches may show up. In rare cases, it can lead to severe complications like encephalitis or meningitis, affecting the brain and spinal cord. Hantavirus. Hantavirus is sponsored by some strains of viruses found in droppings and fluids of rodents. When humans come into contact with contaminated materials, they can become infected and begin to show signs of fever, fatigue, muscle aches, and shortness of breath. In severe cases, it can lead to respiratory distress. Ebola. Ebola is caused by the Ebola virus. It spreads through direct contact with infected bodily fluids or contaminated objects, so you might want to stay away from anybody with it. The victims mostly show signs of fever, headache, muscle pain, and weakness, followed by vomiting, diarrhea, and internal bleeding. Avian flu. Avian flu, or bird flu, is caused by influenza viruses that primarily infect birds. Occasionally, these viruses leave their natural habitat and infect humans, leading to fever, cough, sore throat, and muscle aches, provided humans come in contact with infected birds. In severe cases, it may progress to pneumonia or other complications. Measles. Measles come from the measles virus and spreads when an infected person coughs or sneezes. Its symptoms are usually high fever, cough, runny nose, red eyes, and a distinctive rash. Measles can lead to complications like ear infections and pneumonia, with the worst case being brain inflammation. Zika virus. Zika virus is primarily spread through the bite of infected Aedes mosquitoes, and while its symptoms are mild fever, rash, joint pain, and red eyes, it goes an extra mile with pregnant women, as it may cause birth defects in their babies. Rabies. Rabies is a viral disease transmitted through the bite of infected animals, like dogs. The virus mainly attacks the nervous system, causing fever, headache, and discomfort, progressing to agitation, confusion, and hallucinations. It can definitely cause paralysis and ultimately lead to death. Chickenpox. Chickenpox is an itchy childhood companion caused by the varicella zoster virus. It spreads through respiratory droplets or direct contact with the fluid from the blisters of an infected person. Symptoms include a rash of itchy, fluid-filled blisters, fever, headache, and fatigue. However, if a person with a weak immune system contracts chickenpox, it's a worse case and may lead to more detrimental health issues. Coronavirus. Coronavirus was widely known between 2019 to 2021, a period when washing and sanitizing hands became a compulsory global culture, although it had been in existence far before then. It is sponsored by various strains of the coronavirus family and spreads mainly from droplets when an infected person coughs, sneezes, or even talks. Symptoms can range from mild to severe, including fever, cough, shortness of breath, and fatigue, but it can also lead to pneumonia and organ failure. Dengue fever. Dengue fever is definitely not the same as malaria, but it is also caused by bites from infected Aedes mosquitoes, only that it is more dangerous. Its bite manifests as high fever, severe headache, joint and muscle pain, rash, and eye pain. In worst cases, dengue fever can lead to dengue hemorrhagic fever, causing bleeding, organ damage, and even death. Diphtheria. Diphtheria is a dangerous throat invader caused by the bacterium Corynebacterium diphtheriae. It often leads to blockage of the airways, making breathing a hell of a work. In fact, if it lingers, it can end up affecting the heart and nerves. It comes with signs of sore throat, fever, and difficulty swallowing. But as long as there is no direct contacts, it will not spread to other people. Hookworm infection. Hookworm infection is a parasitic problem caused by hookworm larvae found in contaminated soil. It is advisable to always be on our footwear because skin contact with infected soil can lead to hookworm infection, which often appears in the form of itchy skin, rash, abdominal pain, and in severe cases, it can lead to anemia. Hymenolepiasis. Hymenolepiasis is a tiny tapeworm trouble caused by intake of food and water contaminated with the eggs of the Hymenolepis tapeworm. These tapeworms are parasitic and can be a forceful co-beneficiary of the nutrients from the food of the host. Symptoms include abdominal pain, nausea, diarrhea, and weight loss. Lassa fever. Lassa fever is caused by the Lassa virus transmitted through contact with infected rodents or their droppings. It can also spread through direct contact with infected persons. It comes with fever, headache, muscle aches, and severe fatigue. In rare and severe cases, it can lead to hemorrhagic fever with bleeding and can also damage internal organs. Meningitis. Meningitis causes an inflammation of the protective membranes surrounding the brain and spinal cord. It can be caused by viruses, bacteria, or other pathogens. Meningitis spreads primarily through direct contact with an infected person's saliva, nasal discharge, or other bodily fluids. Symptoms are mainly stiff neck, with possibilities of severe headaches, fever, and convulsion. Monkeypox. Monkeypox is a communicable disease that spreads from infected animals like rodents and monkeys to humans through direct contact. It has a similar nature to smallpox. Symptoms of monkeypox include fever, headache, muscle aches, and a rash that can degenerate into pustules. Mycetoma. Mycetoma is a chronic infection that affects the skin and underlying tissues. It spreads when tiny little fungi or bacteria enter the body through a wound or injury. When spread, the body begins to feel painless swelling or grain-like structures in the affected area. These can eventually lead to deformities and disability if left untreated. Norovirus. Norovirus is a highly contagious virus that causes gastroenteritis. It spreads through contaminated food, water, or direct contact with infected individuals or surfaces. Basically, it thrives in crowded places. It starts with nausea and vomiting and can also lead to fever and stomach cramps. Pneumonia. Pneumonia is traceable to bacterial, viral, and fungal infections that inflame the air sacs in the lungs. It spreads through infected individuals, commonly through coughing or sneezing. Symptoms include cough, chest pain, shortness of breath, fever, and fatigue. Pneumonia can be very deadly if contacted by individuals with weak immune systems. Scabies. Scabies comes with an itchy manifestation caused by tiny mites called Sarcoptes scabii, which dig deep into the skin and lead to intense itching, even worsening at night. Prolonged skin contact or sharing clothes and bedding with an infected person may spread it to yours. Scarlet Fever. Scarlet fever is a bacterial infection sponsored by group A Streptococcus bacteria. Scarlet fever spreads basically through coughing and sneezing. Like the name, some symptoms are pretty reddish. A bright red rash that starts from the chest and spreads across the body. Strawberry tongue, fever, and sore throat. Smallpox. Smallpox is a virus that spreads through inhaling the air around or direct contact with infected skin or bodily fluids. It is caused by the variola virus, which causes rash and flu symptoms in the victim. Smallpox can be severe in some cases and can leave scars and cause blindness. Yellow fever. Yellow fever is caused by the yellow fever virus, transmitted through infected Aedes and Haemococcus mosquitoes. It is a common disease in Africa and South America. Yellow fever shows up with jaundice, the yellowing of the skin and eyes, fever, muscle pain, and nausea. In severe cases, it can cause liver and kidney failure, bleeding, and even death.